Lots of confusion as we enter flu season about when to get your flu shot and your COVID vaccine, or perhaps a booster if you're eligible. Here to get the word out is Dr. Gary J. Sheppard, president of the Harris County Medical Society. Good morning to you and welcome to Houston's Morning Show.
Good morning, Melissa.
All right, so give us your expertise and share that with us about the safety of getting a COVID-19 vaccine and the flu shot, perhaps at the same time.
Actually, the CDC recommends that you can get both vaccines at the same time. It's not unlike when you're children and you're getting your vaccines at 2 months and 4 months and 2 years. There's multiple vaccines you get. So now they have looked at it and said that you can get both the flu vaccine and the COVID vaccine at the same time.
And I'm trying to picture what that would look like. Would you just get it in the same arm, or would they want to do separate arms for that?
You would do it in separate arms. So you'd get a Band-Aid on this arm and a Band-Aid on this arm.
Oh, you'd have Twinkies going on.
Yeah. You'd be balanced.
So let's talk about what, if it matters, if you were on your first dose or second dose. When you're talking COVID vaccine and flu vaccine safe, are you saying that's for both of them?
Right. The CDC says it doesn't matter if it's the first or the second vaccine. You can still get both, either one of them with the flu vaccine.
Okay, now let's talk about those younger children. Would it be safe for a 12-year-old to get the COVID-19 vaccine and the flu shot at the same time?
There's only been one vaccine that's approved for 12-year-olds. That's the Pfizer vaccine. But they would also be able to get the flu and their COVID vaccine at the same time if they were 12 and above.
Okay, and let's face it, we know that people are just weary of vaccines. They're probably tired of us talking about it, and we get that. But why would you say it's really important for people to consider that flu vaccine if they never have before, as well as the COVID-19 vaccine?
We basically tell people the same thing we said last year. It's important to correct things you can correct and deal with the things you can't. So we have vaccines now for both COVID and for influenza. So if we can keep those under control, then we'll have less people in the hospital, less people sick, less people who are out of work because they're sick. We don't want more people to be sick and more people in the hospital. The people in the hospital and the ICUs and the ERs are already overworked. So we want to see, what can we do to help them not have more people to take care of in the hospital? So let's get vaccinated for both of those things, and that should help keep us healthier.
Is there any way to indicate the interest this year so far with the flu vaccine? Certainly early in the season, it seems like things seem to start ramping up with the flu in a typical year, more October, November, up through February.
Yeah, usually it's recommended that we get vaccine in October. So people usually start sort of the latter part of September and then start. So people have been asking about it. My patients have been asking about, have you gotten the flu shot in yet? Can I get my flu shot? So, but they've heard me mention enough times that we've got to give you your flu shot. So they're expecting it. And I think that people who got it last year, some people for the first time, will probably decide, I did fine then, let me get it again because I did well last year.
And last year, when we were seeing all of those COVID cases continue to climb, everybody was wearing their mask at that point. And the flu season was pretty much non-existent last year. We just didn't see much flu here. Do you expect that to be similar perhaps this year, since quite a few people are still wearing a mask and it's harder to share all of those nasty germs if you're covering up your mouth and your nose?
If we can get people vaccinated similar to they did last year, we can get people vaccinated for COVID. People continue to wear their mask, which we should be doing at this point, and not gathering in large crowds without your mask. Then yeah, we should see another lighter season. And no one has a problem seeing a light flu season. Okay, we're all good with that. So keep doing the things that we've been doing that we know work. So vaccines and masking, and hopefully we will have a lighter season.
And if COVID and flu do collide this winter, do you foresee people going into their doctor perhaps and getting tested for both? Because besides, unless you lose your taste and your smell, those symptoms can look pretty similar, can't they?
Yes, you can have similar symptoms for both coronavirus or SARS-CoV-2 and also influenza, but also the common cold. All of them can look similar at one point. So yeah, talking to your doctor, letting them know, these are my symptoms. What do you think? And what should I do? I'm vaccinated, not vaccinated. And we do have medications that we can give for influenza. Unfortunately, we don't have anything at this point that we can easily give orally for COVID-19, but they're working on it. So yeah, talk to your doctor if you're having these symptoms and sort of let them figure out. And you can be tested for both COVID, of course, as most people know, and you can also be tested for influenza.
All right. Dr. Gary J. Sheppard with the Harris County Medical Society. It's great to talk to you. I miss you coming here to the studio, and I look forward to the day when you get to do that again, kind sir.
All right. Thank you, Melissa.
All right. I hope you have a great day.
You too.